A child's early periods of development, autism, and language disorder or a communication disorder can have similar or overlapping characteristics. So, as a parent, it can be difficult for you to know if your child is autistic or if they have a language delay. And one of the three primary symptoms of autism is a communication delay and a social interaction difficulty. So, this autistic child can exhibit a lot of language communication and understanding difficulties during their early periods of development that can lead you to confusion if your child is autistic or if they have a language delay. So, if you want more clarity on if your child does have autism or only a language delay, then keep watching this video to learn 6 differences in development in a child with autism versus in a child with a speech and language delay. Hi, I'm Priyanka Evangeline, your internet speech language pathologist. Make sure to watch the video till the end to get all the tips on how you can differentiate the two diagnoses. The first skill is pointing. So, when a child is developing, especially around the 8 months to 1.5 years of age, you will see that your child does a lot of pointing in order to ask for something that they want. Pointing is usually to ask for something your child wants or also to show you something interesting that is happening. Let's say you're going to the beach and then there is lot of balloons in one stand. So your child will show you the balloons to show you that this is so interesting. Do you look at? Can you see it? But in a child with autism, predominantly we don't see a lot of pointing behavior and sharing of interest. And since our child with autism can have a difficulty with interacting with others, connecting to others, understanding people and their facial expressions and their language, they also exhibit certain difficulty with understanding our smiles or our emotions. So, responsive smile can be reduced or missing in an autistic child. Responsive smiling means when you look at your child and smile, they will smile back. Or when you suddenly call your name and say hi and smile, they will give you attention and smile back to you. So, this is responsive smiling, which can be difficult for an autistic child. The third difference is their reason for motivation. You can sometimes see that your child is more motivated or they will do a task only if you give them some type of, tangible reinforcement like a chocolate or a toy rather than just giving a smile or a praise or a hug. So you will see that for an autistic child, motivation is predominantly motivation to do a task or to talk or to interact with people is predominantly an object or a food item or a thing. Whereas for a child with a language delay, the motivation can be objects or things also, but you will see that it's not always objects, but it is also sometimes smiles. So even when they do something and you smile and say, "Yay, nice, good job," you will see that when you say this, it motivates your child to do more of that behavior or to talk more. Be motivated by verbal reinforcements like good job, nice, also by facial expressions like wow, yes, So when you smile, also it motivates them to do more of the task. Another skill you will see is imitation in a child with a language delay or a communication delay. For example, if your child might start wearing dad's shoes or the bag and walk around or act like dad or try to do cook or try to cut vegetables or like if you're wearing on lipstick, your child will also try to wear on lipstick. So you will see that children imitate actions of people during the developmental period. And this imitation is seen more in a child with a communication delay. Whereas a child with autism, since we were discussing that they have a difficulty with understanding people, their emotions, their facial expressions, their language, it is difficult for a child to first understand what we are doing and why we are doing those things, because then it also becomes difficult for them to imitate. So you will see a lot of imitation is reduced or absent in a child with autism. You will also see that children are very interested in their environment. And for a child with language delay, you will see that they are interested in the objects around the environment as well as in the people. So they also enjoy spending time observing people. So if there are many people in the house, they will try to talk to them, come to them, listen to them, sit with them, observe them from a distance. Most of us, we will not do something that is difficult for us. We will always choose the easy thing. So, if understanding people and their language and their actions are difficult for us, we will not choose to do it. So, a child with autism can be often seen observing objects or observing inanimate things around the house, or maybe even animals more. Animals and appliances, vehicles around the house, rather than observing people. Now, a child with a language delay can also be seen observing objects, but you will see that interest in people, interest in interaction, and looking at people, and smiling in response to somebody, or having an interest to talk to other people, will be more in a child with a communication delay than a child with autism. So, if you leave your child alone for some time, you will notice that they try to engage themselves in certain toys. You may have blocks and storybooks and cars for your child. They will try to do that. But yeah, if nothing is there, then they will get bored. Or if they are doing it for a long time, playing alone for a long time, they will get bored and they always seek us and, ask our attention to keep them engaged and to keep them busy. But if you see a child with autism, they derive a lot of understanding from the environment and from objects, and they do more of that than coming to a person and asking them to talk to them, or asking them to play with them, or asking them to for their attention, because those tasks are difficult for a child. In a child with a language delay, like for example, when you say let's bath, and or when you say let's eat, or when you say it is gone, where is daddy has gone to office. When you say these type of languages and associate it with certain gestures, it is easier for your child with a language delay to understand. But you will see for in a child with autism that, for example, when you say I don't know, when you say let's go, you will see like gesture understanding is delayed in a child with autism. During the developmental period, children also use gestures by themselves before they start talking. So there is a lot of non-verbal communication. For example, when they are happy, they look at you and they smile. They may not smile just to themselves, but they will convey their happiness to us, or they will call us, you know, using the gesture to call us. They will ask for something. They will say eat with a gesture. So this type of gesture use during the developmental period is more in a child with a communication delay, because the delay is more in verbal language development but not non-verbal development. You will see that gestures are present in a child during this 1 to 2 years of age and even afterwards. Type of symbols to use during communication, understanding this concept can be a bit difficult for a child with autism. So you will see that he or she will not be using a lot of gestures. And language disorder can look different. But if you have been watching the video so far, you have heard certain terms that I said. That is a difficulty with social interaction, or understanding people, understanding language, understanding symbols. So this video is not meant to diagnose any child, but it is just for you as parents to understand your child's child better, to help them better. Now, that being said, as a speech therapist, We always use play based activities and child led therapy during the early period of development, regardless of your child has autism or your child has a language delay. So don't try to get very caught up in the diagnosis of what is it. Is it autism? It is autism. Is it autism? But try to focus on doing play based natural language stimulation activities with your child to help them get the language skills. Especially for an autistic child, you will be working on language understanding, symbol understanding, using gestures, reading facial expression, sharing interest. So these are some of the goals you can start working with your child. But regardless of the diagnosis, the way we teach, especially speech therapy, the way we teach a child is always through play. And start playing and teaching with your child. And if you want more resources on how you can play and teach, watch this video that I'll be linking above. And if you also want to know how to improve my child's social interaction abilities, I have a free tutorial on YouTube that you can check out. It has 6 videos that describes why our children can have a social interaction difficulty and what you can do about it. I have given 15 home activities you can do in that tutorial. So watch that here.
Okay, so that's all for today's video. I'll see you in the next video. Bye.